Hello, everyone, and welcome. We will begin the seminar in about 2 minutes. We're just waiting for more people to join, so sit back and relax. Hello, everyone, and a very warm welcome to the Hallmark Research Initiative seminar series. And before we begin the session, I would like to pay my respect and acknowledge the Wurundjeri people of the Kulin Nation, the traditional custodians of the land in which I and many other participants in this seminar live and work. I would also like to pay my respect and acknowledge elders, past, present, and extend that respect to other Indigenous Australians who are present in this meeting. My name is Ilan Wiesel, and I'm a lecturer in the School of Geography at the University of Melbourne. I've got a long-standing interest in researching housing affordability with a particular focus on housing for people with disabilities. I'm also a member of the Affordable Housing Hallmark Steering Committee, and I'll be chairing this session today. So the aim of the seminar series is to bring together interdisciplinary perspectives into the question of affordable housing, to showcase some of the research that we're doing and funding through the Hallmark, but also engage other researchers across Australia and internationally, as well as policymakers, practitioners, and other citizens, and anybody who has an interest in this field in affordable housing. The topic of today's seminar is COVID-19 and vulnerable households. And as you all know, COVID-19 is sort of a once in a generation, once in a century global event, unprecedented in its scale and the severity of its impact on economies and on society. And at the same time, the problems that this pandemic brings, it really exposes existing problems in our housing, in our labor systems, in social policies, and those problems are not new. So those questions of how COVID-19 impacts on disadvantaged and vulnerable households, in what ways does housing produce or might mitigate against vulnerability of households to a pandemic, is arguably one of the most burning questions of our time. And we have 4 wonderful speakers today to speak about these critical questions. I'll introduce the speakers separately, one after the other before they speak, but I'll just mention their names now. So we've got Kate Rayner, Emma Power, and Kate Colvin. And we've also got another video presentation by Ken Gibb, and he will be joining us later for the panel discussion. So the way the session will run We've got each of our speakers will speak for 7 minutes in turn, and then we'll have a panel discussion. Now you can write your questions using the Q&A feature on Zoom, and we'll use those questions during the panel session. I do want to thank Holly Jones for our excellent work in organizing this session. And our first speaker today is Kate Rayner. So let me introduce Kate. Dr. Kate Rayner is the academic convener of the Hallmark Research Initiative. She's a postdoctoral research fellow at the University of Melbourne. Before joining the Hallmark, Kate was involved in the Transforming Housing Research Network, also at the University of Melbourne. And in her current role as the academic convener, she's responsible for shaping and supporting housing research across the university, including championing this seminar series that we're now all participating in. Kate has got a background in urban planning, and her research focuses on cross-sectoral partnerships and policy networks for affordable housing and the lived experiences and housing satisfaction among low-income households. So I can say Kate, as the academic convener of the Hallmark, is sort of the beating heart of the initiative, and very much her research on COVID-19 and shared household is the trigger for this event today. So over to you, Kate.
Thank you, Ilan. And I like that as a description. I like being a beating heart, so appreciate that. You should be able to see my screen now. I imagine someone will have yelled at me by now if that's not true. Thank you to the Hallmark for funding this research, and also thank you to my co-author Laura Panza from the Faculty of Business and Economics. I'm presenting on work that we've co-developed, so credit to her contribution also. And so what am I talking about? I'm talking about the impact of COVID-19 on members of share households in Melbourne, in Victoria rather. And I chose this topic partially selfishly out of curiosity, but also because I think there are a lot of elements about members of share households that contribute to their vulnerability at the best of times, but are very much things that are exacerbated in the context of a global pandemic, to do with their age, to do with their engagement with the workforce, and to do with their engagement with housing systems that mean that this is a particularly vulnerable group. And I also think that this is a group that is infrequently thought of in a grouping, in the same way that we might think about members of social housing. So I thought it was a group that not only needed research, but also needed advocacy to point out the specific issues that relate to them. So I'm talking about them for that reason. So what did we do? We conducted a survey in June. These statistics are from June. We had just over 1,000 responses, and we're conducting a second survey in October as a longitudinal study. And we're also halfway through some interviews as well to get a more qualitative idea of what is happening amongst share households in Victoria. And what I was interested in was really how prevalent are shocks or adverse events amongst share households in response to COVID. What is driving susceptibility to risk, even amongst this vulnerable group who is most vulnerable? And then also, and I think very importantly, what are the individual, social and external insurances or resources that people can draw upon in the context of what Ilan called, this unprecedented event or disruption? And in terms of who responded or who lives in share housing, the response group skews young. There's a high proportion who are casually or contractually employed. There's a majority of respondents were Australian citizens, but there was a big proportion of permanent residents and visa holders. Most of our responses were from Melbourne, but there was some regional Victorian responses. And most were renters, although there are some homeowners who are subletting their home to other people in their homes. And what we found is that shocks are really prevalent, are really, really common. And I guess the headline figure is the fact that almost 3/4 of respondents had either lost their job or had their hours decreased, which is really high level. 47% said their financial situation had gotten worse. And then if we kind of look down into the pointy end of the graph, 1 in 5 have gone without a meal to be able to afford the rest of their costs, and 22% couldn't pay their housing costs on time in the 3 months leading up to the survey. So some really, really bad statistics coming out of this research. And if we look really specifically at housing, over a quarter are in housing stress, so they're paying more than 30% of their income on housing costs, and then 18% are spending more than 50% of their income on their housing costs, which, as we know, leaves very little for other things that you might need to afford. So they're really bad numbers. And to speak to that notion of turbulence or movement in share households, we found that a really large proportion of people had either moved home to their families, had housemates move out, had housemates move in, moved in with partners. So 39% of people in the responses had some form of housing change in their household. So lots was happening. In terms of vulnerability, there's bad figures across the entire cohort, but things are much worse if you're younger than 35, much, much worse if you're a visa holder as compared to a citizen or a permanent resident, and also, unsurprisingly, worse if you are casually employed. And those figures came out across, I guess, all of the different shocks that we were looking into. And then when we turn to what kind of resources individuals or households can draw upon, what we found is people had very few personal resources to support them in a crisis situation. So weekly incomes were much lower than the Victorian average. Median savings were much lower. Almost a quarter had less than $500 savings at any given time. There were high levels of debt or difficulties paying debt, rather. Although also high levels of educational attainment, which we could talk more about. In terms of social networks, people had relatively good social networks and support from their friends and family, and 1 in 5 were receiving financial support to varying degrees from friends or family to support them through COVID-19. But what I found particularly interesting is the importance of JobKeeper and job seeker payments in this group. Now, a third of people were receiving JobKeeper or job seeker payments. Only 20% were successful in getting a rent reduction. But those payments from the government were very important. And we also conducted what my colleague Laura calls a horse race analysis to look at what was the most important indicator or access to resource that reduced people's shocks. And what we found was that government support time and time again was really, really important. Unsurprisingly, having low debt and high savings was also important, but that wasn't the case for most people that we surveyed. So in terms of implications, I think it's very obvious across COVID experiences that housing, public health, and social welfare are very much intertwined notions. And the way that people occupy space and the access to housing that people have very much then translates through to people's capacity to be safe in a COVID situation, but also to be safe outside of those situations as well. And what we heard was that there was lots of interpersonal conflict, particularly around having intimate partners in a household and negotiating essential workers and things like that across non-traditional households. As I mentioned before, JobKeeper, Job Seeker, and Commonwealth Rental Assistance packages came out as really important. And as we know, and as it's federal budget day, this is something that's going to be changing over time and will have implications into the future. We see that there's some real challenges around rental rights and confidence and knowledge around rental rights, and a need to think specifically about share households, given how many people in share households are subletting or informally connected to rental and therefore have perceived or real less access to rental rights. And then finally, I think there's an important research question to keep asking, or policy question to keep promoting, which is about these movements of people who perhaps are moving away from places they moved to for education or employment opportunities to other places to be with family or to reduce their housing costs, and what the long-term implications of those moves are going to be when we think about housing policy and urban topics more generally. And finally, final slide, because it is federal budget night, I think we'll all be saying very similar things, but some of the things that we should be doing to address this lack of affordable rental is talking about Commonwealth rental assistance increases, talking about increasing and retaining job seeker payments because they're vitally important. Across the supply side, we should be talking about affordable build to rent, not just build to rent. In Canada, we've seen quite large programs of federal funding going into purchasing hotels and motels and housing stock immediately to supply affordable dwellings. Of course, I would support inclusionary zoning. And if we talk about this from a governance perspective, I think it's time for the federal level government to have a national level housing strategy, because we haven't had one for 30 years. And I think everything really stems from that centralized response and policy focus at this point. So I will conclude there, and there will be time for questions and everything at the end. But thank you very much.
Thank you so much, Kate, for this presentation. Very striking, even startling figures and findings. I do encourage everyone to start sending through your questions through the Q&A. So Kate will answer some of those during the panel discussion. So our next speaker is Professor Ken Gibb from the University of Glasgow. We will hear Ken in a pre-recorded video, but Ken will also join us for the panel discussion. He is in Glasgow, so there is a time difference, of course. Ken Gibb is the director of the UK Collaborative Centre for Housing Evidence and a professor of housing economics at the University of Glasgow. His research interests are focused on the economic, financial, and policy dimensions of housing, and currently is working on the financing and economics of social and affordable housing and the application of behavioral economics to housing. I don't have time here to list all of Ken's contributions, but I'll mention only his role as managing editor for Urban Studies. It's one of the most prestigious journals in our field, and is also a chair of the Sanctuary Scotland Housing Association. So let's hear Ken's video. Thanks, Holly.
Hello, my name's Ken Gibb. I'm the director of the UK Collaborative Centre for Housing Evidence based at the University of Glasgow. I'm going to talk to you for a few minutes about the housing response to COVID-19 in the UK since March, and then a little bit about some research that we are now undertaking at the UK Collaborative Centre for Housing Evidence, or CASH as we call it. So let's start by saying a little bit about some of the key facts relating to the pandemic in the UK. Lockdown started on the 23rd of March and was significantly released from the end of June onwards. We've now been reintroducing local lockdowns as spikes have been identified in different parts of the UK, and about a quarter of all the UK's population, and indeed all of Scotland, are now under forms of local lockdown, though generally speaking these are not quite as severe as the earlier total lockdown was, but we appear to be on an escalating curve. Cumulatively, there's been about 400,000 cases of COVID-19. That's about 7 per 100,000 of population. The total level of deaths has been somewhere between 40 and 50,000. It's quite hard to say because these precise definitions keep changing. As in much of Western Europe, positive cases are rising quite strongly at the moment, and we're anticipating further restrictions to freedoms and mobilities in order to try to short circuit the rapid increase. And I think Britain, like many parts of the world, is facing an invidious trade-off between public health concerns and objectives of the pandemic and trying to manage our health versus the economic damage that's being done to Britain's economy and to jobs and to the future. There have been quite a few controversies recently about the handling of the COVID pandemic in Britain. Just recently, there's been problems over the new academic year for students, where many students across the country, but starting in Scotland, have been locked down in their halls of accommodation for quite some time. There's considerable variation in local lockdown rules across the country. Not everybody understands the basis of those rules, including some of our ministers in government. And there is considerable controversy over the perceived gap between the capacity of test and trace in parts of the UK with the actual outcomes on the ground, which appear still to have gaps and suboptimalities, as it were. So let's talk about lockdown and housing. Number of things to say. That housing was certainly affected by Britain's enthusiastic take-up of furloughing measures, the so-called job retention scheme, which protected the incomes of millions of people whose work ended in lockdown, provided they weren't made unemployed per se. We've also had support for self-employed people, though there appear to be some gaps. And we now have something called a job support scheme, which is modelled loosely on the German approach, which basically provides some income protection, shares the cost between employer and employee for jobs deemed to be viable going forward. That's just happened, so we can't really talk about can't evaluate it in any meaningful way yet. And we also have had a softening of universal credit rules and an increase in the value of the basic allowance that people receive. In the housing market directly, there's been a mortgage market holiday. This is a voluntary deferment of mortgage payments, individually agreed between lender and borrower, but taken up on a very large scale, and a process that'll carry on as late as March next year for people. Private rented sector has had significant lockdown measures introduced. Each country, the UK, has different but similar controls over evictions, preventing evictions or suspending evictions since lockdown began. And that has different time limits on it going forward, depending on what part of the country you are. Basically, Scotland and Wales are the most generous, and Ireland is the least generous. England sits somewhere in between. There's also been some voluntary forbearance over rent payments, and indeed local housing allowance, the social security payment to help people with their private rented housing costs, has been marginally increased. What's not clear though is what the long-term plan is for when the evictions restrictions unwind. We've also had rough sleeping, major policy there to move people out of temporary accommodation, congregate temporary accommodation or living on the streets, into secure single property occupancy, often in hotels, but also in some social housing and other private rented solutions. Originally, about 5,000 people were successfully taken off the streets of those situations. It's now gone up to 15,000, mainly the people at the rough end of the temporary accommodation system. So again, there are long-term issues about how will this be turned into a permanent solution, or will there simply be a return to the kind of homelessness there was before? And finally, we've had a construction shutdown and a market shutdown for a large part of the spring this year, but that's been replaced by a rebound where the market has responded quite strongly, which has clearly pent up demand and things like that. Government also wants to pursue some recovery policies, making stamp duty less onerous by making the first £500,000 of it in England and Wales, in England and Northern Ireland free, and in Scotland the first £240,000 free. Help to Buy, which should enable people to become first-time home buyers in the new build market with equity loans, has been extended to 2023, and the government's also pursuing some radical planning deregulation ideas. So my research centre, CASH, has been working with Hal Pawson at the University of New South Wales to develop some ideas about how we might add value by doing research on COVID, research that we own. And what we're interested in is policy making under crisis, as it were. So how will lockdown policies, how did they happen and why did they happen? Why were they so housing focused? Will they be reversed? Will they be extended? Will they evolve, or will they be retained as time goes on, and why is that the case? So we're going to follow these policies over just over a year. We're going to repeatedly return to key stakeholders who are working in the decision-making processes and ask them what's going on and why it happened, as it were. We're going to also look at the literature, media discourses, and the kind of timeline of these processes, as well as speak to some frontline policy delivery bodies as well. And we're going to have about 6 different sub-projects in this programme, looking at all the areas I've already discussed, but also things like domestic abuse, about some planning issues, and about the resilience of the private sector institutions like development industry, private landlords, the mortgage lending industry, and how this will differ to the global financial crisis. So I'll be very happy to talk some more about these things in the panel session, and I hope you find some of this discussion of interest. Thanks very, very much, and I'll see you soon.
Many thanks to Professor Ken Gibb, and Ken will join us in the panel again. So please do feel free to send through questions through the Q&A for Kate and for Ken. Our next speaker, it's really a delight for me to introduce Dr. Emma Power. Emma is a senior research fellow in the Institute of Culture and Society at Western Sydney University. Her program of research is concerned with urban living and the politics of care. It envisions a world of more caring and just cities, asking how cities can better support human life and the practice of care through studies of housing systems and governance, urban planning and cultures of home. Emma is editor of the International Journal of Housing Policy and co-founder of the Housing Journal podcast. And I think Emma's work applying a feminist care ethics as well as critical infrastructure studies to thinking about housing and urban policy and culture is really groundbreaking and sort of inspired a wave of followers, myself included. So it's always a pleasure to hear Emma speaking. Over to you.
Thank you, Alan. I think you can see my screen now. I'm speaking today from the unceded territory of the Gundungurra people, and I pay my respects to their elders past, present and emerging, and any Aboriginal and Torres Strait Islander people who are here today. So I'm going to talk today about the housing experiences of single older women who are 55 and over living in the private rental sector in Australia. Now, the research I'm going to draw on was conducted prior to the pandemic, but I'll also reflect on the position of this group during the pandemic and on some broader thinking about what these experiences tell us about the housing system and on where we need to head next. So we need to start by recognising that this group is one of the most vulnerable in the housing system in Australia. They've been recognised as one of the fastest growing groups of homeless people in the country, and they're overrepresented amongst the asset poor. We've known for some time the risks that this group face, but recent research by Lawrence Lister and Debbie Faulkner has for the first time put some data against it. So it presents some really staggering facts. It estimates that 245,000 women aged 55 and over and 430,000 women aged 45 years and over are at risk of homelessness. And it shows that women aged 45 to 55 have nearly double the risk of homelessness compared to men. And renting is one of the key factors that drives this risk. When it comes to their housing situation, these women face 3 broad interconnecting risks. The first set are gendered risks. So they might have taken time out of the workforce to care for children or be working in lower paid caring professions across their life course. So they're living on lower incomes, and then when they retire, they have limited assets, including superannuation. These gendered risks are compounded by an unaffordable and insecure private rental sector. This is a system that is allowing people who have the money to invest in housing to secure their future, while it leaves these others to struggle at the social and economic margins in substandard housing, and with insufficient money left over from rent to be confident that they can afford to buy their food or pay their energy bills. These gendered and housing risks are then further compounded by inadequate income support payments and a housing market that simply does not provide housing for the bottom quintile of incomes. So let me tell you these women's stories. These women are facing many housing challenges, but I thought I'd focus today on the issue of housing affordability. So the Productivity Commission's 2019 report on vulnerable households shows that low-income renters are paying rents that are well above the income affordability quotient of 30%. This left the women in our research struggling to pay their day-to-day costs. So most explained that they would pay their rent before they bought food, before they paid other costs, because failure to do so would result in eviction. I'll give you two examples. So a number of women described difficulties getting landlords to do repairs. And one woman, Tracy, had an especially striking story. She lost access to around 40% of her property over a 2-year period due to leaks. Now, she had notified her real estate agent on numerous occasions, but received no response. She said she didn't want to push because she was afraid of an eviction or rent increase. Eventually, 2 years later, the property is repaired, and as she expected, the rent went up. She was left with only $30 a week after her essential costs were paid. She said she couldn't afford food at this time, and she described her efforts to survive as being, quote, like my job. She said that she relied on one local charity where she could get a monthly food voucher and another one that opened a weekly food pantry. Another example is Tony, who had a low-paid contract during school terms and received Job Seeker, or what was then New Start, over the summer break. She managed by buying vegetables that the local greengrocer bundled and discounted before throwing out. But during winter, when she had extra heating costs, and during summer when she couldn't get work, she was relying on a local church that opened a weekly food pantry. This food, which was donated by local supermarkets and community members, was frequently past its best before date. And she described to us how, as a low-paid community worker living in a community with a large number of disadvantaged families, she was actually collecting food alongside her clients. So these examples speak to a broader experience, and they're why the Productivity Commission last year described the private rental system in Australia as a driver of disadvantage for low-income households. So what are the effects of COVID-19 then? Well, for this group of renters, COVID-19 has been a really mixed bag. As older people, they're physiologically more at risk of the virus. But in Australia, perhaps the more immediate risk to many is to their mental health and well-being. Living alone, they're at much greater risk of social isolation and loneliness, particularly if they're faced with lengthy periods of lockdown like we've seen in Melbourne recently, or I think we're in the midst of. Economically, some will be worse off because they've lost work. While some will be temporarily better off, they'll have benefited from the rise in Job Seeker and from the advent of JobKeeper, which are payments that better recognise the cost of living in Australia. However, the vast majority will be in exactly the same position. They're struggling to pay rent and to meet their essential needs. So what the experiences of this group highlight to us is an ongoing failure of the private market to support the needs of vulnerable households. We've known this for a long time. So what is it that's special about this moment? I think what's important right now is that there is growing public recognition of the central role that equitable access to secure, affordable, appropriate housing plays in securing community health and well-being. Housing has a really central role in this pandemic in enabling lockdown and self-isolation, and an ongoing failure in the housing system brings risks to the community as a whole. We need to keep telling this story about the social value of housing to challenge the broader and growing political and practical framing of housing through a financialised lens. This positioning of housing as an investment, as a tradable commodity and an asset has typically accelerated in the aftermath of recent crises. So we saw this in the US in the post-GFC context, where large-scale investment firms were buying up large swathes of housing across the country, while low and middle income households that had faced this mortgage foreclosure and eviction from those homes were primed as tenants to service the investments. So in other words, the crisis was repurposed to further build the ownership aspirations of the already wealthy, while further exploiting those who were victims of the crash. These sorts of stories, I think, should be a real warning to us, particularly in light of programs like Home Builder, and in light of proposed tax cuts to high and middle income earners, cuts to Job Seeker and JobKeeper, and the ways that rent deferrals are being understood as landlord loans rather than rent exemptions. I think the practicalities of how we can avoid this are probably they're uncertain, and they're perhaps for our later discussion. But philosophically, what they point to is a need to build a deeper public narrative around the purpose and value of housing. That housing is a social good. And as I put it in my work with Kathy Mee, housing is a care infrastructure. It's the primary infrastructure through which we collectively meet the means of survival and pursue a flourishing life. It's ground zero for care, and the ways that we design and build housing, that we organise housing markets, and that we govern housing, infrastructurally organise our society-wide capacity to flourish, let alone to survive. I think recognising this can give us a new starting point for our conversations about housing, and I think are crucial if we want to reclaim the importance of housing to our collective future at this time. Thank you.
Thanks so much, Emma. And I think those questions that you're posing to us are some of the key questions we'll need to discuss today about the story of COVID and how we tell it. And our fourth and last speaker today is Kate Colvin. Hi, Kate. Many of you will know Kate or have seen her face. Kate is one of the leading advocates for housing system reform in Australia. She's manager of policy and communication in the Council to Homeless Persons, and had led several campaigns trying to build public support for changes that need to happen in our housing policy and housing system. This includes the Everybody's Home campaign, which brought together over 100 organizations as partners. And Kate is the spokesperson for this organization, or the campaign. And she's also played a key role in the Australians for Affordable Housing campaign, and led the National Vote Home campaign over the 2016 federal election. So looking forward to hear your presentation, Kate.
Thank you, and I would also like to join others in acknowledging the Wurundjeri people of the Kulin Nation and pay respects to elders past and present. So what I want to do today is actually talk really specifically about homelessness and what's happened during COVID to people who are homeless in Victoria, and use that example to sort of bring forward some of the issues that others have talked about around housing, because of course the two are very tied together. So I'll just open my presentation. So to explain a little bit about what's happened around homelessness, I need to talk about some of the figures of how many people have been affected. So you recall back in March, COVID hit Australia, and very quickly in Victoria, the Victorian government responded with an increase in resources to put people who are experiencing homelessness in hotels. Which was very positive. I mean, I think what they were really recognising is the extreme vulnerability of people, particularly who are rough sleeping. Many people who are rough sleepers have chronic illness, are vulnerable in their health, and also, of course, when you're sleeping rough, you don't have access to washing facilities necessarily, or the ability to limit your contact with others. So it was a good idea to put people into hotels, and I think it has certainly enhanced, made people kind of safer during that time. But it's also exposed some challenges in how homeless systems work when the focus is all about crisis accommodation. So to talk about some of the numbers, when we generally think, well, how many people are rough sleeping in Victoria? We have over 24,000 people counted on census night who are homeless. Of those, only just over 1,000 are sleeping rough. But what happened when the government made hotel accommodation available to people who are rough sleepers is that in a 3-month period, over 6,000 people were assisted. And so why would that be if there are only 1,100 people who are rough sleeping? So the reason that that is the case is because people who are rough sleeping it's not a static population. And I think part of the thing that people get confused about in thinking about homelessness is thinking, oh, there's just this group of people who are rough sleeping. And the fact is that from one night to a night 3 weeks later, the group of people who are rough sleeping will include some of the same people and many different people. And that's because when people are rough sleeping, what tends to happen is people cycle through these 4 forms of accommodation. So people will move into a rooming house. It's the only private rented accommodation that someone on a very low income in a city like Melbourne can afford. But that rooming house is often really poor condition. It's often dangerous. There might be other people there who make a person feel unsafe. And so they might leave that rooming house and go back to rough sleeping, or they may make a friend or contact an old acquaintance and go and couch surf at someone's home. And then, of course, that relationship breaks down, and they might go back to rough sleeping, get picked up by a homeless service and put in emergency accommodation, but that's only ever very temporary, and they'll be moved back into a rooming house, and around people go. So what happened when the government made a better form of emergency accommodation available is that people came into that accommodation from all 4 forms of homelessness. And so, you know, quickly we ended up with more than 6,000 people homeless. 6,000 people in crisis accommodation. So that then also presented some challenges. People who were low need coming into those hotels were able to be assisted into private rental accommodation, because another thing the Victorian government did, which was positive, was provide extra resources for people to move to be housed in private rental accommodation. So if it was a family group who were able to afford a low-cost rental in private rental, then they were able to move quickly through the hotel accommodation and into that private rental. But there was another group who can't afford private rental, even with increased job seeker. So quickly we ended up in a situation where about 60% of people in the hotels were about 3 in 4 people were single households, and that's the hardest group to find rental accommodation for, because if you're on New Start payment, job seeker payment, you just can't find a rental to afford in a city like Melbourne. About 60% had high support needs, and among that group included 40% with mental health issues and 40% who are long-term homeless, who'd been cycling around those 4 forms of homelessness for a while. And so then we end up with a situation where all of these people with these high support needs are in hotels. There were some hotels where there were 40 or so people, all who had been homeless, who were all in that hotel together, locked down. And there were so many people coming through homeless services that the few support resources there weren't able to stretch to meet the needs of everyone who's in hotels. So you can imagine that that created some real difficulties. You've got people who have really high support needs, mental health problems, sometimes drug issues, all sort of squashed into a hotel together in a high pressure environment, because lockdown is very stressful for everyone, let alone if you've already got a mental health problem. Excuse me. And so the support resources were so stretched, only about 1 in 3 people were able to get any support. So there was a lot of really difficult situations created as a consequence of that. And so what I think this highlights is that there's a real, I suppose it raises a question about the value of that kind of crisis accommodation in a situation where people can't move through and out into a longer term rental. So I want to talk about that a little bit because it's been touched on by the others. But the fact is, in big cities, really across Australia, but particularly in expensive cities, it's really hard for people on the lowest incomes to be able to afford housing. So the reason is because rental costs keep increasing much faster than people's low wages. So particularly at the cheaper end of the rental market over the past 2 decades, rents have been increasing really fast. So people are more and more squeezed out. And there's not a social housing safety net because it keeps contracting. So, you know, whereas in 2006 we had 5.6% of all of the housing in Australia was social housing. Now I can't see that figure because it's behind the slide, but I think it might be 4.6% is social housing. So that's basically just means it's much harder for people to get into social housing. So I guess that's where I wanted to end, is why advocacy is so important to change this situation, because for a great many years, academics, the community sector, you know, economists have all been talking about how important housing is as infrastructure, and social housing in particular, to create a functioning housing system where everyone has a home. But governments are not listening, and unless we're very much surprised, tonight will be another example of a lot of great policy wisdom that's been communicated to government being ignored. So that's why the community sector created the Everybody's Home campaign, to really be able to unite a broad set of voices behind this call to really fix this problem and create the housing so that you don't end up with that situation that I've described, where the people who are most vulnerable get trapped in that cycle of homelessness. And even where that cycle includes crisis accommodation that's decent, like it has during COVID, it's still, it's not a pathway through into housing. It's another form of, you know, it's like a hotel room that's expected to be someone's home for a long period of time. And I should, just before I move on to just explain just that little bit more about the campaign, there was one more thing that I wanted to mention about the hotel situation for people who are homeless, going back to those numbers, is that while the government funded around 4,000 people at the end of May were in hotel accommodation, now it's only about 2,000. And so the other 2,000, only a very few of them have been able to move into private rental. Most have moved back into that cycle of couch surfing, rooming houses and sleeping rough. So it's a very disappointing outcome in many ways. There has been some additional resources for longer term private rental, subsidised to the amount that people would pay if they're in social housing in Victoria, but that funding isn't yet available. So whilst there will be some good outcomes for some people, the fact that there hasn't been social housing has meant that many people have had a temporary burst of decent accommodation, but are now back in the cycle of homelessness. So just to conclude, and I was just saying the reason that we created the campaign is because we need to move a homelessness system from this, which is a slide that I've sort of borrowed from some Canadian homelessness experts, which talks about creating homelessness service systems that are really focused on that emergency response, don't do enough in prevention, and don't move people into housing because there's not the housing there. So you create a homelessness service system that's not really about solutions. It's not about ending people's homelessness. And what we're trying to create is a homelessness system that has housing at the front and housing at the end. So if housing is available, people don't become homeless. And if housing is available, then if they do become homeless, a service can easily rehouse them. And so the reason that there's not enough housing is because government keeps decreasing its spending on housing, and I think we'll see that again tonight. So here we are at a crossroads. So this is the, just give you the information about how to connect in with the Everybody's Home campaign, because it really is about a movement of people who are concerned about growing homelessness and the importance of investing in social housing to end that. So you can join the campaign at everybody'shome.com.au. So thank you.
Thanks so much, Kate. And thanks to all our 4 presenters, very excellent and sobering presentations. So I'd like to invite our panelists to turn on their cameras and join a panel session. And I'd also like to invite participants and the audience to send through your questions through the Q&A again. And welcome again to Ken. Thanks for joining us for the panel discussion. So I can see already we've got a few questions coming in through the Q&A. And the first one is, what percentage of social housing is required to meet demand? Does any one of the panelists would like to answer that? I guess percentage as the stock, I guess the total stock of our nation housing stock.
I think it's around about 10% is generally what's estimated. I don't have the percentage in my head, but I know that the Australian Housing and Urban Research Institute have calculated it's a shortfall at the moment of 433,000 properties in Australia.
Okay, so 10%, and right now we're at about 4.5, so that's a very big step up the ladder. Thank you. And
just to add in there, Alan, I think, the real challenge that we have is that the market simply is not providing housing for households in the bottom 20% of incomes in Australia. And so that's why this becomes particularly crucial. A lot of politicians will sit back and they'll say that housing is it's your own problem. You need to work out a way that you're going to get your housing, or that it's a market problem and that the market would ideally provide those needs. But what we see is that it's simply not providing that housing, and that competition from higher income households mean that what we call a second quintile of incomes, so that's the people who are in the bottom 20 to 40% of households by income, they can't afford housing because the higher income households are renting in their affordability category. So it's a big problem, and it's something that we really, but there's only one solution to it, and that is social housing at this point.
Thank you. Kate, did you want to add anything? Okay, Rainer.
Just on that $430,000 unit number, that's something like 30,000 units a year, which is what we produced over the last decade. So if we're reflecting on how much change we need, it's that big. It's so much more.
Thank you. I've got another question here. At the moment, there are 13,000 empty apartments in Melbourne CBD, and it keeps increasing as there has been an exodus of renters. CBD apartment rent asking prices are now $200 a week less. Is there a way these private rental apartments can be used as affordable housing and subsidised?
So there's a really good piece of research that the Hallmark funded by Erica Martino looking at this exact question, which was looking at the head leasing of apartments by community housing providers or something like that. And what she found was that one of the perverse outcomes of the rental eviction rules at the moment, which are excellent, have actually created a bit of a barrier to doing that in an easy, straightforward way. But I mean, that's something that can be addressed. So I think this is a really good time to be having a conversation about either purchasing units. And I know in Canada, I mentioned very briefly, they've just committed, I think, $1 billion to supporting community housing providers to purchase units and hotels and motels to get that affordable housing supply straight away. So that's something that we could certainly be looking at. And if not purchased, then head leasing arrangements, I think would be an obvious kind of pathway to go down, given that there is so much vacant units at the moment.
If I may, Eileen, in England, the Affordable Housing Commission has recently published a second report which essentially suggests the case for a housing conversion fund, which would use a mixture of public and private finance to do exactly the same thing, to try to pick up particularly property in the private rented sector and return it to social housing. And interesting in relation to the previous question, the kind of general number that's being used in England is around a need for around 90,000 new units of affordable housing every year for the next 10 years. And in Scotland, that figure's about 10,000. So you know, considerable numbers. And whereas in the previous or the current Parliament in Scotland, we've actually achieved those numbers until COVID happened. Of course, there's nothing like that in England at all.
And may I ask, what is the percentage of social housing as a proportion of the total housing stock in Scotland?
Well, that's a good question. It's around a fifth, and the interesting thing about it is that it has been falling for 30 years, but it's actually started rising again as a consequence of abolishing the right to buy of discounted council sales completely in 2016, and 2 Parliament's programmes of additional investment in social and affordable housing. The net balance is actually increasing now, only very slightly, but that's a huge difference to everywhere else in the UK.
Thanks, Ken. Yeah, so that's a big difference from Australia, 20% versus our 4.5%. We've got another question here about inclusionary zoning. What inclusionary zoning rate would we need to set to meet, I guess, the gap, to meet the shortage?
I don't know that anyone ever thinks inclusionary zoning would fill the whole gap. So I think it's reasonable that inclusionary zoning would be set at sort of 1 in 10 properties in a sort of reasonably sized development. But there would still need to be a government subsidy to meet that whole 433,000 gap.
Thank you. How do we ensure new housing is created in locations convenient to jobs and support services?
I think we don't have a problem providing housing in the locations where it should be provided. It's just we have a problem providing it in a way that someone on a low or moderate income can afford it. And I think one of the things that we're discussing on this panel is that the private market simply is not providing housing at the level that would be viable for the people we're talking about. So I mean, inclusionary zoning is one way of encouraging the private market to be involved in that process. And I think the other is investment in social housing, and potentially there's the use of government land as well for siting of that social housing, which I think needs to be another element that's thrown into the mix too.
Thank you.
And just to add to what Kate's saying, like for the use of government land, you know, when government invests in a urban development, often then that increases the value of land in that area. And so it sort of makes sense then to use part of that additional value to deliver social housing, so that newly improved location can be somewhere that low-income households can afford to be as well. I mean, I think probably many of us are in Melbourne, so you think about the development of the Dandenong kind of precinct and all of the investment that went into the sort of that kind of urban area. And I don't recall that social housing was kind of included in that. And so Dandenong has then had an increase in rents because it's, you know, been made more attractive. And so then sort of ironically that urban improvement has sort of pushed out low-income households, whereas they could have been built in at low cost to government because of the increased value at that time.
And just to add in, Alan, I think one thing that's really important is that we remember that people who need access to jobs at some point in their lives retire, and at that point they still require access to affordable housing in regions that are well located. If someone has, you know, lived in the inner city, for instance, across their whole life, they'll have built a community in that place. They might have family there. They'll certainly have friends there. And for older people, these connections are really vital to being able to age in place. I mean, and you know, the sort of social and cultural dimensions of why that's important are really clear to us. But you know, if we want to put on the government's economic hat, we can also see that it's cheaper. The Productivity Commission recognised a few years ago now that it's cheaper to support people to age in place than it is for people to be put prematurely into nursing homes, which is exactly what happens if people can't afford to continue to rent their housing in the place that they've been, or if they can't continue to live in a place with the supports around them that would help them to do that. And so I think, you know, often we think about key worker housing, but we need to, that's affordable. It's a proportion of market rent, but we need to think about housing that's lifetime affordable.
Thanks, Emma. We have a question from Ted Bellew in our chat. What are best practice examples of new social housing projects in Australia, and what are the average costs of those projects? But what I guess constitutes best practice in innovative social housing delivery? I know you've done some work, Kate, on that.
Yeah, I was finding the unmute button. I can talk about some of my favourite examples. One of my favourites is by Common Equity Housing Limited, and it's in Abbotsford. And what I like about it is that it's a mixed tenure development. It's on a small scale, it's really well located, it's combining social and market housing and disability accessible housing through the specialist disability accommodation scheme. And I think in terms of design outcomes, I think it's a really nice development. One thing I don't think is best practice about it is that I think it's very reliant on NRAS, and so perhaps some of the majority of social housing tenants in there might be higher income rather than, you know, the most disadvantaged, which is where we need the most stock. But in terms of delivering something that is bringing together in a really good product in a really good location that supports people's needs, I think that's a really good example. And I really like the Drill Hall development in Melbourne as well, and the partnerships that they combine to provide housing there. In terms of average cost, it's really hard because it really depends on the land cost and like all of the different elements that went into it. The only thing I'm thinking of that I know of was the study done by KPMG of the social housing initiative after the global financial crisis that had a average cost of $330,000 per unit, but of course that was 10 years ago. And so I think, I don't know, maybe other people, maybe Kate or Emma or Aline or Ken might know, but I wouldn't know at an aggregated level, particularly since it's so dependent on location and what's delivered.
Thanks. Does anyone want to add? Yeah.
I was just going to add two examples from the UK that are quite interesting. One is a development in Norwich in England, which has won prizes for architectural innovation and development, which is a development to passive house standards across the board. And what's interesting about it is that it's normal council housing. It's straightforward council housing, which has become possible again since the Theresa May government changed the borrowing controls and constraints on local authorities. So that's a mixture of different kinds of local and central public funding, but it's normal council housing from an allocation point of view, but it's a very high energy efficiency standard. The other one that's quite interesting, something I'm working on in Glasgow, where a community-based housing association, which deals in traditional tenemental housing, working with the city council, has essentially acquired an empty block of what was privately rented homes in an area where the council has a strategy to try to change tenure, to basically try to break up the private rented sector and get the properties into the housing association, third sector, as a form of social housing, which kind of mirrors the policies of the 1970s and 80s and 90s when community-based social housing evolved in Scotland. A lot of it was simply the local authority-driven transfer of ownership between the private rented sector, landlords selling up and building up block by block these properties, which are often 100 years old or more. And it's quite interesting that that's still happening today and that the council's facilitating that. So the transfer happens largely grant funded to the association, and then they will seek further grant funding to improve the stock before tenants come into it.
Thanks, Ken. I've got another question here from Ted Bellier, which is about the role that housing construction costs plays in, I guess, driving affordability or unaffordability in the Australian market.
I think that the biggest cost is the land, but the construction cost, of course, is sort of part of the parcel. There's some good research which talks about the different costs in different locations by Julie Lawson, which is the same piece that has the 433,000 shortfall. And I think it also breaks down the construction cost and land cost in different locations. But I don't have all of those figures in my head. But so if you Google Julie Lawson and social housing supply, you come up with it.
Thanks. Another question from an anonymous attendee about partnerships and what partnerships would be ideal in producing projects, affordable housing projects, and are there different or more lateral versions of this? I'm looking at you, Kate Rayner. Again, it's an area I know you've got some interest in.
Yeah, no, I think one thing I should always premise my responses to this, because I get excited about partnerships because I think they're interesting and I think they deliver really good projects a lot of the time. But one thing I should always say first is the reason that we focus so much on community, like not-for-profit and private sector partnerships, is because the state and the federal governments have taken a step backwards in providing social and affordable housing. And I think that's egregious. And I think that in celebrating innovation and partnerships, we can't kind of look away from the fact that there needs to be more policy leadership and more funding and more involvement from state and national governments. That said, I think there's some really useful partnerships arriving or emerging between, for example, local government and community housing providers. And there's examples across Melbourne and Victoria in Australia where, for example, local council is providing air rights above their car parks and then working with community housing providers in really useful ways. Church groups as well can do a similar thing in terms of providing air rights or providing leasing of their land to make those relationships happen. One of my favourite partnerships is between the Brotherhood of St. Lawrence, which is a community organisation, and TAFE, where they've provided Education First youth foyers, which is housing for young people who can't live at home anymore and are attaining education. And they've done a really beautiful job of providing a really well-structured housing offering that is also connected to education outcomes and services, and connected to jobs and health and mental health support mechanisms as well. And so I think, and that was done in collaboration with the state government very strongly from a policy perspective. So those kind of relationships, I think, can work really well. And there's also a role for social impact investors, banks and superannuation funds, inevitably, when we start to scale up these projects. And that's something that should be more and more included in these partnerships as well.
Can I just jump in and add to what Kate's saying? Because I think there has been some really, and the ones that Kate describes, really exciting partnerships, but sometimes what's left, or generally what's lost, in sort of searching for the way to produce social housing without government having to spend money, is scale. So, you know, you can have community housing as a great sort of innovator, and it works by a community housing organisation can pull in a bit of subsidy from here, take some air rights and to reduce the land costs from local government, and then build a development. Say they build a 20-unit development, sell 5 of them off to the private market, cross-subsidise using the profits from that to produce some rental housing that's affordable rental for key workers. But if there's no government subsidy in there, they'll be lucky to be able to produce 1 unit out of all of that complexity that's for someone who is an older woman who, you know, is on the pension and who really needs social housing. But with a government subsidy, the community housing provider could do the same 20-unit development, still have it mixed use, because I think that's good for other reasons, but produce, say, half of it as social housing and half, 7 of them as affordable housing and sell only 3 into the private market. And the reason that that's important is because we have only so many community housing providers. Within those community housing organisations, there's only so many of the skilled staff that can put a development like that together. So for every development that you do that only produces 1 unit of social housing, there's an opportunity cost there that effort and expertise could have gone into producing something that actually delivers for people who most need it.
Thank you. And Ken, is there any additional insight you'd like to add, I guess, from a UK perspective?
Well, I mean, I think there are a range of partnerships that are well entrenched, and often it's a private-public partnership, which is the essence of how housing associations have worked really since the late 1980s in the UK. But more recently, there certainly is more philanthropic capital than there used to be. So there's a real interest in social investment funding. One of the areas that's going on in right now are developing models to purchase properties off the shelf for long-term solutions for the people who were rough sleeping during the COVID lockdown, who went into hotels and other forms of temporary accommodation. And I know there are partnerships of philanthropic capital, longer-term private sector patient capital, matched government funding, sometimes from local government, and they're trying to buy properties off the shelf to scale. I mean, I'm talking about some individual partnerships which are looking to, take over 1,000 units in a geographical area, most of which will be off the shelf, some of which they would try and, access developments which are underway. Similarly, related to homelessness, there are homelessness prevention measures going on in London, for instance, which are social investment, social impact bond type arrangements where there are payments by result if the partnership delivers successful outcomes for individual clients, i.e. that they retain secure housing for a period of time. That makes the payment by result mechanism work. So there's quite a lot of interest in evaluating those sorts of models. Again, that's mixed funding between government and the social investor.
Thank you. I've got a question from Andrew Middleton. Where did it go? Yeah. Thank you for the sobering presentations. Broad question, moving forward, what would some of the panelists recommend as the best steps we could take to tackle the short-term issue, but also have positive outcomes for the medium to long-term situation?
I mean, in Australia, with the budget on tonight, I think we could say that funding social housing would be an excellent short-term application of funds. Every dollar that we spend on housing has broader economic impacts. It creates jobs, but people also spend money as they furnish those places. If people have secure housing, they're more able to access employment. So there's social benefits as well. Rather than something like Home Builder, which has already been announced, which is simply going to increase the investment value of already well-off homeowners. If we simply put that investment into the social housing space, we'll reap short-term, medium-term, and long-term benefits. I think as well, there's other sorts of opportunities that are perhaps not going to have such an immediate or large scale impact, but that we can think about. I mean, I've been speaking to some MPs recently in state and federal portfolios around housing and homelessness. And each of those conversations, they've told me about landlords that they've been hearing from who say, well, I don't want a tenant in my property for 6 months or 12 months. I want someone in here long term. How do I find them? And who will say things like, well, I don't need to get absolute top dollar. I see that, that housing has a social benefit. I'm getting a tax break for this house. I'm willing to rent it out at a more affordable level to provide that social good. I think there's questions around how we actually activate some of those benefits. Not all landlords are predatory. There are some landlords out there who are willing to provide and willing to act in the social good. And there's questions about how we might activate that as well.
Yeah, just on that about landlords acting in the social good, I find home ground real estate a really good example of a social enterprise that is set up as I guess it was connected to launch housing to do exactly that is a really good mechanism for linking homeowners who would rent at a sub-market rate to eligible tenants as well. I think that's a good point, Emma.
I've got a question from Andrea Cook. Hi, Andrea. What are the barriers to mandatory controls at the state level? And are there any insights from the panel on how advocacy in this area can step up to really deliver stronger planning controls? And I think that links to Emma's points about the stories that we tell about vulnerability and disadvantage in the pandemic. So interested to hear your thoughts as a panel.
I might take a first swing because I've just done a study on this exact topic. And not just, I mean, we did the survey a year and a half ago, and we asked, what would you prefer? Would you prefer voluntary affordable housing agreements negotiated on a case-by-case basis, or would you prefer a mandatory inclusionary zoning scheme? And there was a few other options. And across every single sector, they said, yes, we would prefer inclusionary zoning, mandatory at a state level. So I'm really confused why we still have so much barrier to this. This is something that we've been asking for as an industry for decades now. And it's very upsetting to me that we haven't had that movement. I like to see the affordable housing agreements and the change to the Planning and Environment Act that happened recently as a step in that direction. But I think it continues to be voices in industry that say that inclusionary zoning is going to push up house prices, and there is some evidence that that could occur. But it really depends on the design of that system. So in terms of how to move that discussion forward, I don't know, I think we need to keep the pressure on for that to be a valid outcome, and to not let COVID be an excuse to say that we should stop working for better planning processes around acquiring affordable housing.
Kate Colvin, you've done a lot of work, I guess, speaking about those issues in public, and what are your insights?
Well, it's the development lobby is a really powerful political force. So I think when they say, it will push up the cost of purchasing housing, it's not strictly true, but it's believable. And in some cases it would. I mean, the real thing is that it would push down the price of the land that is purchased to do a development, rather than that it would push up the price. So it becomes, they say it would push up the price. We say it won't really push up the price, and they have more money to put behind their effort, and also very strong relationships with political parties, and so far they've succeeded in stymieing efforts to have inclusionary zoning brought in, but we continue to push for that policy because it would make housing more equitable for everybody.
If I could say, in my video, I alluded very obliquely to planning reform in England, and there's really remarkable things going on in England just now, with government basically announcing in a kind of consultation exercise that they want to end the sort of discretionary planning permission based basis for land release and replace it with a 3-part zoning model. And within that, they will end altogether the current Section 106 basis by which quotas of affordable housing or other infrastructure get done as the deal for planning permission. And alongside that, the resource that's being made available for social and affordable housing has been shifted towards shared ownership, and it's part of and also discounted home ownership for first-time buyers, which has become a major part of what a lot of the resource that would have been used for Section 106 agreements is now going to be used for these discounted home ownership schemes in England, and so it's a very a priori driven as opposed to evidence driven set of policies, which at their heart are about a belief that housing supply is limited in the market because of the planning system, and secondly that the real housing issue remains falling rates and frustrated home ownership aspirations rather than the evidence about social and affordable housing. So planning is going to be the battleground for the next few months and years in England, and it's noticeable that the rest of the UK is studiously ignoring this in the sense that that's not in their on their agenda at all. So it's a really interesting time for how all this is going to pan out. But I don't think it's going to help housing intervention in the meantime at all in England in particular.
I see members of the panel nodding, because you find that the stories, the narratives are quite similar in Australia?
Yeah, I mean, I think the England part of the UK has really moved away from sort of social housing development, and with terrible consequences for people who are on really low incomes. And so it's sort of really interesting to sort of observe, I suppose, the differences with Scotland building, truckloads of social housing and reducing homelessness as a consequence, at the same time that England is going the other way. But I think that the outcomes speak for themselves.
I think, one other thing I'd add is that we don't have the 3-year electoral cycles that you have, but we have 5-year cycles for the devolved Parliament elections. So both Wales and Scotland have elections in the spring. And obviously we have lots of elections at UK level. We've had 5 since 2010, I think, something of that order. We are really struggling to get long-term programmes of agreed policies that actually sustain a programme of work over a 3, 4, 5 year period. And in Scotland, after 2 parliaments of successfully implementing 5-year programmes, we've no idea what's going to happen beyond May. We just don't know. We kind of know there's some residual spending for the first year of the next parliament, but there's no programme in place, and there won't be till June, July next year. So that obviously affects development hugely. So that I've always felt we need to build consensus in order to enable longer term funding certainty and programme certainty, which we really urgently have always needed. And I would suspect that the notion of a 3-year cycle in Australia makes it much, much worse with you.
Thank you. Okay, another question from an anonymous attendee. We've been having this conversation about affordable housing over 30 years, but what are the opportunities that COVID presents to us? And Emma, you've started speaking to that.
Yeah, I think that's a really great question. We have a political culture in Australia and other countries like Australia that is increasingly being built on individualism, on individual benefits and individual responsibility. And I think that what's so special about COVID, and it's what's so awful about it as well, is that it shows us how we're all held together. It shows us how housing inequality and employment inequality tie everybody together. I mean, in Australia, in Melbourne, what we've seen is that much of the pandemic, the way that it's been driven in the most recent round, has been from communities that are housing disadvantaged, where people are living in more cramped conditions, people who are in more vulnerable employment conditions where they can't take time off work, they need to go to work when they're not well. And we see that this has pushed everybody, even the most wealthy people, even those who've had the luck of a fantastic job and a great housing outcome in their life. They've also been in lockdown. They were also eventually, have the risk of becoming unwell. So I think what it is it's a political moment. It's showing us what's wrong, and it's showing us that we're tied together. And I think, there's been some really fantastic but awful campaigns in Australia around things like mining taxes and carbon taxes that have driven public opinion. And I think it shows us that there is a real opportunity perhaps to drive a campaign around housing, and not just what's wrong in housing, but on the social good of housing. What is it that housing does? How does housing tie us all together collectively? What's the social good? I mean, in my work with Kathy Mee, you know, we've been writing about housing as a care infrastructure. How does housing work as a care infrastructure? What is it about the way that we design housing, about the way that we govern housing, about the way that we distribute housing through our housing markets that could bring good to all of us? And I think that that's what's really powerful about this moment.
Would anyone like to add more on the opportunities that COVID presents to us?
I think maybe just on that, I guess, increased level of empathy. So I'm doing these interviews at the moment for the Share House project. And one thing that came out of the interviews and out of the survey is these conversations I'm having with people who have never engaged with the social welfare system before, talking about their feelings of loss of sense of self. Like, oh, you know, I'm getting JobKeeper, but I've never been like this before, you know. Like, I think there's a group of people, as Emma said, who are now engaging with what it feels like to be insecure in a way that they probably never have before. And I hope that leads to greater empathy. And I hope that it leads to greater empathy and policy, but I don't know what's going to happen in this budget tonight. I'm feeling a bit deflated, to be honest.
Can I just add one of the other opportunities is that, and Emma talked about this before, is that the construction of social housing creates a lot of jobs and delivers a lot back to GDP. So when there was a big housing construction boom during the GFC, every dollar spent delivered $1.30 back to the economy. And that's really because you can't build a house with, it's not like something else that you can build with imported goods. You have to use domestic labour to build a house, and the residential construction sector is about to, you know, really fall off a cliff in terms of forward contracts are already, you know, really slowed down. So the opportunity was there, or is there. There's still a couple hours until the Treasurer stands up to, you know, get those workers working and deliver a social good. And it's something that has a great history, that has a great Liberal and Labor tradition. So, you know, Menzies built a lot of social housing after World War II. Fraser, you know, contributed a lot of federal resources to help rebuild Darwin after Cyclone Tracy, as well, of course, as the Rudd initiative after the global financial crisis. So we're certainly hoping that the federal government, you know, take that proud Liberal tradition and bring it, you know, to life again for this crisis.
A different kind of opportunity that a lot of people are talking about in Britain and trying to tie it to economic opportunity is how we meet our carbon reduction targets, particularly in relation to the existing housing stock. It's probably a lot easier to use regulation to address much of the issues with the new build sector comparatively, but our really big problems are with existing stock. And one of the statistics that the Scottish Government always uses is that 80% of the housing stock in 2040 already exists. And as I say, in cities like Glasgow, we have an awful lot of pre-1919 homes, which are just the worst kind of carbon emitters. So people at the Institute of Public Policy Research, the Affordable Housing Commission that Lord Best led, and also, you know, different parts of government, including in Whitehall in London, are putting resources aside to think about retrofit programs and trying to scale them up. And the Institute of Public Policy Research was really interesting because they see this as a basically a job program for people who've lost their jobs under COVID and the recession that we're now in. And they want to link this to proper skills and training program packages so that people can learn to install, things like air source heat pumps and the like, and they can learn how to maintain them, and it can be a kind of wraparound service. And how would you use different kinds of technologies to heat and produce affordable warmth in different housing contexts? So there's a real momentum, and actually it's as much a business momentum as it is a policy wonk kind of momentum. The money's, there are all sorts of incentive issues about how you do this, about how you encourage people who are asset owners to take a big upfront cost, which will only pay back over a long period in the future, particularly hard for private landlords. But there's a real momentum building up about that. We have a body called the Green Finance Institute in Britain who are producing all sorts of whiz-bang ideas about clever ways of funding these things. So I think that's actually quite exciting, and COVID has really pushed it down the track well, I think, and made it a much more prominent issue. And we have COP26 in Glasgow next year. So there's a whole kind of set of things going on which might help all of that.
Thank you so much, everyone. We've reached our end of our time. It's been really wonderful to hear all of you speak, and I'm glad we got to finish on a more positive note, just ahead of the budget, with some fingers crossed for really good housing news. And so thank you to our 4 speakers, to Kate, Emma, and Ken, for your contributions. Thank you to all participants and attendees for your questions. And please do join us again. We have another seminar in 2 weeks on voluntary affordable housing negotiations on the 22nd of October on a Tuesday, 4 p.m. Thanks, everyone. Have a good night.
Thank you. Bye.
Thanks, everyone. I'm going to end the webinar now.
Thank you.